So what do these numbers essentially indicate? Where are we in terms of booster shots, and how worried should we really be about Omicron? Professor Dr. Anita Ramesh Chandra, specialist in clinical trials, joins us. She's also professor and head of medical oncology from the Apollo Speciality Hospitals in Chennai. Thanks very much, Doctor, for being with us. We have Dr. Subhash Salunke, member of the National COVID Task Force and senior advisor to the Public Health Foundation of India with us. We have Dr. G.C. Khilnani, chairman, PSRI Institute of Pulmonary Critical Care and Sleep Medicine. Thank you all very much for joining us. Dr. Salunke, to you first. Many questions about India's strategy in terms of dealing with Omicron. Now, what we've seen in South Africa is an over 300% spike in cases in the last week. Worryingly, an over 250% spike in deaths in the last week as well. So, if this is the evidence that we have from South Africa, which accounts for about South Africa and Botswana account for about 70% of global cases of Omicron, are we prepared for the times to come?
I think if you look at the preparedness shown by state of Karnataka just before, you have shown the interviews given by the health minister of Karnataka, and also overall preparedness demonstrated is a correct way of facing this particular challenge.
Okay.
And I feel rest of the states in the country need to follow what is being done in Karnataka. As a matter of fact, the guidelines that have been issued by Government of India need to be strictly followed. And I personally feel that the entry of Omicron in this country is now foregone conclusion. It is there. It is going to happen. And we need to consider, even though fortunately the situation in South Africa is indicative that the cases, incidence has gone up, but the virulence is low. That means the criticality is low, the number of deaths are low. That's very, very positive. However, that shouldn't result into complacency. And from that perspective, let us be more vigilant and let us try to take all the steps as narrated. I can go on and go on, but at the same time, clearly Karnataka is demonstrating the way forward for rest of the country.
But Dr. Salunke, as someone who is a part of the National COVID Task Force, the one thing that we saw last time, and that's a pattern that appears to be repeating because, the nature of the federal structure in the country is that every state makes its own rules. Do you think that when it comes to dealing with a variant of concern like Omicron, perhaps decisions need to be taken and all states need to uniformly look at this together?
Definitely. All states necessarily, jolly well, will have to follow the guidelines of Government of India.
Okay.
Certainly they can improve upon that. There is no problem, because suppose states differ in the risk kind of an category, and hence, like say Mumbai, and you can't compare with any other city with Mumbai. Mumbai is international airport. The people are going to come from abroad. So naturally, Mumbai city, Maharashtra will have to be more stricter than other states where there are no international airports. So I personally feel that the strictness above the guidelines of Government of India is welcome step, but you can't dilute that, saying that, okay, nothing is going to happen. That there is no scope for that. Absolutely no scope.
All right. Dr. Khilnani, many questions about what we know about Omicron so far. The World Health Organization India representative in an exclusive interview to NDTV yesterday says, yes, preliminary evidence suggests that, Omicron is more transmissible and has therefore the potential to overburden or overwhelm the healthcare system here in India. Are we ready to brace for impact?
So, Rishika, few things have to be understood. What we know and what we envisage. What we know that Omicron is a new variant which is more transmissible, that of course we know. So far we understand that it causes mild disease, that we know. We expect that the vaccines which are being used so far will be effective against Omicron also, because they were effective against Alpha, Beta and Delta vaccine. But we should learn from our previous experience. The Delta came in October and havoc was in April and May. Now India is at the advantageous and disadvantageous position. The advantage is that our sero survey was very strong. 67% of the population is already immune, and more is because of the natural infection, which gives the best immunity as compared to the vaccination. The disadvantage is that we are in a heterogeneous country. The travel is immense from all over the world, and I strongly feel that, and this is my gut feeling, that Omicron is already in India. Maybe we have not been able to detect it because it takes time for sequencing.
Yes, which is the other question? Dr. Khilnani, if you look at the headline coming out of Bengaluru, I mean, it's pretty shocking, because what we're essentially acknowledging is that by the time we figured that patient number 1 was infected with Omicron, he tested negative, took a negative certificate from a private lab and went back to Dubai. That's very dangerous.
Yes, that is dangerous. I totally agree with you. But the other thing is, what can we do? That is what is important. The one thing is that one should not presume that this is a mild infection and will do nothing to us. Now, the behavior of virus changes depending upon the host also. Some person will have mild illness, some people will die with the same variant of virus. That we need to understand. Virus changes behavior. As far as the testing is concerned, we should understand that PCR has a sensitivity of 70 to 80%. That means if you test 100 positive people, you may pick up only in 80 people, and 20 people will be tested negative. That we need to understand. So what we can do? Now, we have to live with Omicron. We should understand that. I don't think it's going away anywhere by any kind of restriction. But what is the best vaccination? The best vaccination is the second dose, which gives immunity, and second is COVID-appropriate behavior.
Yes.
Yeah.
Yes. Dr. Anita Ramesh Chandra, this is what I want to ask you very specifically, as someone who, specializes in dealing with cancer patients. Just going back to that WHO India representative who spoke with NDTV yesterday, he also stressed on the fact that while, we need to look at the science behind booster shots, the WHO does recommend booster shots for the immunocompromised cancer patients undergoing chemotherapy. Now, a government panel, the INSACOG panel, has also recommended boosters for all those above the age of 40. Do we need to expedite that here in India?
Yes, I think, Rasika, it is high time. It has started in the other countries in the world already. India has been discussing all this last one, and we did also discuss in the same forum earlier, but it was maybe not implemented. But yes, Omicron threat is now going to hasten and speeden it up. If you see the cases which are rising, and particularly we healthcare workers have to deal with it, we need to be vaccinated. Okay, not only doctors, paramedical, nurses, pharmacy, even after the security and housekeeping has to get their additional dose. Better to call them an additional or a booster dose. Even I am a cancer specialist. I'm a consultant at Apollo dealing with oncology cases. Yes, all my patients are immunocompromised. They need their next dose, which is rather an additional dose I will call not a booster dose. Even the high-risk individual above the age of 60 needs the jab, and all the individuals who have organ like hypertension, diabetes, kidney problem needs the thing.
But what does this tell us? You have said, Dr. Chandra, what does this tell us? Does it tell us that the current vaccines will not work, or does it tell us that the current vaccines will have a diminished efficacy against Omicron?
Yeah, it will have an efficacy but diminished. We have seen earlier what happened in Delta, 10 to 15%, all the vaccine across the world, say Moderna, we have reports from Johnson & Johnson and Pfizer, everybody had 10 to 15% decrease in efficacy. Right. Similarly, we are hoping Omicron will have, but still you should take the vaccine, because vaccine will give you more than 50% protection. Remaining, we can continue with the COVID appropriate behavior. And over a period of time, it will tell us, research will tell us what is the efficacy, what is the virulence. But as on today, vaccination is must, and we have to complete our entire vaccination, 2 doses for everybody, and simultaneously roll out.
Okay. Well, when you talk about strategic vaccination, it can't be an either or. It can't be either vaccinate your population fully or give boosters. Like Dr. Chandra is also saying, it has to be a simultaneous approach where you vaccinate the vulnerable while, of course, increasing vaccine coverage to the maximum population, especially given the fact that Omicron is here, and from what we're seeing in South Africa in terms of the spike in cases and deaths, it is indeed a worrying sign. Thank you all very much for joining us this morning. We will, of course, track this story very closely.